Hi, and welcome to everyone who's tuned in to see this first BSIR panel event on a very important condition, pelvic congestion syndrome. I'm Aidan Shaw, I'm a consultant interventional radiologist, and I'm delighted to be joined by a colleague of mine, Narayan Karunanithy from Guy's and St Thomas's, to talk about this condition, and also really delighted to introduce two patients who have suffered with the condition and will tell their story to us tonight. So many thanks to Nicola and Kerry, who are joining us tonight as well. The purpose of tonight really is to try and bring the awareness of this condition to the forefront, so that clinicians and patients and even interventional radiologists can be more aware of it and how important it is and how much of a difference can be made to patients. So I wanted to hand over to Narayan now to see if he can briefly talk about the condition and what it involves.
Yeah, thanks, Aidan. Thanks for the introduction. And it's such a pleasure to be here doing this first BSIR live stream event, and really pleased and delighted to have two patients, Kerry and Nicola here, who are going to tell us their stories from their perspective. But just to sort of set the scene, really, pelvic venous disorders of the abdomen and pelvis has really come to the forefront, and our understanding of it has exponentially become greater over the course of the last decade. And that's because we've just been through work that you've done and we've done, and as many other centers have, but really precisely sort of characterizing symptoms, signs to go with the sort of the underlying mechanisms, and really getting an understanding of what's going on through state-of-the-art imaging techniques. And that's really given us an ability to understand what's going on within the pelvis in a way that we hadn't been able to do before. And then as a result of that, really be able to select patients who could do very well from the interventional treatments that we have available to us. So it's really all about the understanding pelvic venous disorders in a way that we have not been able to do previously. So so really that's where we're at. Venous disorders, we know broadly, can result in leaky veins or, in some cases, obstruction to veins. And what can happen is you can get symptoms that from both presenting in very similar ways, and sort of really unpicking that is really key, and then to understand which patients do well. So that's, I hope that provides a sort of like a little sort of taster to everyone about what we're going to be talking over the next, 45 minutes to an hour or so, as a way of introduction.
Yeah, thanks, Narayan. So I want to first hand over to Kerry, really, and introduce Kerry, and if you can talk to us about your diagnostic journey to where we got to, if that's okay.
Sure. So basically, I've been suffering with terrible pelvic pain since the birth of my second daughter. That was in about 2013, and my periods were just gradually getting worse and worse. I kept going back to the doctors and gynae, and they kept just sort of fobbing me off, giving me the pill, said that would gradually settle things down, but I just don't react very well to hormones. So from there, in 2019, it was gradually getting worse and worse. And I just had such bad pressure in my pelvis, pain in my legs, leg swelling. And I went into hospital, and they said that basically they didn't know whether my appendix were rupturing or I was having sort of a gynae issue. So I kept getting passed from ward to ward. They didn't know what was wrong. And then eventually my appendix did rupture. So I had them removed, and they also said that I had some gynae issues, and which needed following up. From there, I went home. I had quite a traumatic sort of time in hospital, and gradually I started to feel a little bit better, and I thought it might have been my appendix that had been causing it, but my gynae issues were still very much there, and I had such bad pain and terrible like pressure, almost like I was giving birth. So it was just dreadful. From there, I went back to my GP, and they once again gave me another pill. I tried that again, and it didn't really help at all. So I came off of it again. I just kept getting heavy bleeding and terrible pain. In my discharge note, I'd noticed from the hospital, this was some time after, that on the bottom of the letter, it said that I had chronic pelvic congestion syndrome with lots of question marks. And it was quite hard because nothing had been mentioned to me about it. So I just sort of put it to one side and didn't think of it. And then from there, my symptoms were just getting worse and worse. The pressure was dreadful. I was suffering with really bad UTIs as well. The doctor sent me for another scan, and on the scan, it was visible that I had the veins showing again. So I started to think, well, what is this? Then lockdown happened, and I'd been for this scan, and they noticed that I had a thickened womb. So they sent me for they sent me a letter and said I needed an urgent operation to check the thickened womb, just to check for any cancer. But this was cancelled, and I had to wait 6 months, and I just had heavy bleeding. It was a dreadful time. And then eventually I got called back in, and again, they just kept offering me the coil, and I just knew something wasn't right, and I just kept sort of doing my research. After that, I decided, after lockdown, I decided to go back to the GP, and I said that I'm really concerned about these veins, and I sort of said I've looked into sort of pelvic congestion syndrome, but they didn't seem to know what it was. But I said, please, can I be sort of transferred back to gynae? From there, I'd seen the gynae consultant, and he said, oh yes, you have got veins in your pelvis which are enlarged, and he said you can try the coil. With that, I sort of did my research again, and I found out about Dr. Shaw. It was in the Daily Telegraph, and it seemed like he really knew what he was talking about, and he'd helped a young lady with pelvic congestion syndrome. I had every symptom going of it, so I was sure that that's what it was. So I contacted him. I contacted his secretary, and she came back to me kindly, and he said he'd have a consultation with me, which was very kind of him. And when I went, I had the consultation with him over the phone, and he invited me in for an MRI to check the veins in my pelvis. And from there, then I got the treatment that I needed. So,
right. Yeah. Well,
sorry, quite long-winded.
No, absolutely. No, this is what's really important about it, Kerry. So thanks for sharing that, because it highlights the journey, the long journey that typically women go through to get to the diagnosis. So thank you very much for sharing that.
Okay.
So Narayan, did you want to?
Yeah, Kerry, thank you again. That's really helpful and really insightful on how it can be, as you described, quite a long journey. Hi, Nicola. Would you be able to tell us how you got to the point of us figuring out what was going on with your pelvic venous condition?
Yep, sure. Mine again is quite a long-winded story. It all started when I had a ruptured ectopic pregnancy, and I lost the left fallopian tube. I then fortunately went on to have a baby by cesarean. due to bilateral DVTs during pregnancy. He had to be delivered by cesarean. One was in the femoral vein, so the risk of me going into labour was, they deemed, was too great. I then had multiple operations for adhesions, which is a bit like a vicious circle, and then had a microablation done as well. So I never suffered really heavy periods, but I had this pain for years, well over 10 years. I can't even really remember when it began. So I had this constant pain. Again, I went to the GP, they offered me the coil. I couldn't take the pill because I was, unfortunately, incorrectly, it came to light about 18 years later, diagnosed with protein C deficiency, but I don't actually have protein C deficiency. So I went back and forth, so I couldn't take the pill because of that. I couldn't be prescribed that. So I was really just left to get on with it, in all honesty. I went back to gynae again, had lots more tests done. I had an MRI done, and that's when I saw the MRI report, and it mentioned pelvic vein congestion syndrome. I went to gynae and they said there wasn't, there was nothing really wrong. There wasn't anything they could do. And I said, what about the pelvic vein congestion syndrome? And they said, well, there's not really much. And I said, well, I've done some research and I understand there is a procedure and that can be done. And I actually work at the same trust as Aidan Shaw, but I was obviously a patient of the trust, and I'd read about Aidan and I'd seen some bits that we get through as well about the work he does. And so with me pushing, they did refer me on to Aidan. I do also have a bit of endometriosis, but very small. And I really didn't feel, by the pressure that I felt and the pains in my legs really relate to that, Kerry, because the pain in my legs was so intense at times. And it just felt like something was pulling down. It was just awful. And then what happened is I had a consultation with Aidan, and he kindly said that he thought he could help me, which he did. It changed my life. I've lost over a stone in weight, so I can go to the gym again. I have more energy than I've had for years. I'd also had thyroid cancer, so I have to take, obviously, medication for that. So I'd struggled. And it's just, I didn't realise how much pain I was in until I wasn't in pain anymore. And the fact that I'd coped with that pain for so long, it's just been life-changing. The other thing is I have actually recently, I'm on a waiting list for a hemorrhoidectomy, but I thought that something had changed, and I don't think, I haven't told Aidan this, it's very recent. So I went to see, I asked for a consultation, but they said I was on the waiting list for surgery. So I went to see the consultant privately, and he had a look, and I haven't got them anymore. And he thinks that's because of this procedure that's been done. They've gone.
Amazing.
Yeah.
Thanks so much, Nicola. And thanks for sharing that and coming on to share your journey with us as well. And I just wanted to go back to the both of you, if that's all right, and just talk through how intense the pain can be, and talk us through the exact pain that you experience. If you want to start, Kerry, and talk us through the pain that you're experiencing and how is it affecting your daily life.
Sure. Basically, the pain I was feeling was just so intense. It was like, almost like, I can describe it as giving birth, basically. So gradually the pain it'd start around sort of ovulation time. The pain would sort of be like a dragging pain sensation in my pelvis, like pulling down, and it would go into my legs would swell. Then during period time as well, it was horrific. Some days I didn't feel as though I could walk with it. And people, the funny thing is, people look at you and think, oh, well, you look fine, you look well, but I try to do everything I can to kind of make myself feel better. But some days it's just awful. The fatigue is just so bad. So it's just an awful thing to live with, really. So I'm just so grateful that you've been able to help me. Because the pressure is definitely it's definitely helped to stop that. So that's been amazing. And the leg pain, because it's almost like you start afresh in the day, and gradually as the day goes on, the pain just gets worse and worse, and then you have to start again. So it's like it is a struggle daily, and I don't think people really understand it, of how much it affects your life and your mood and fatigue of it. So it's just, yeah, it's a hard thing to live with.
Absolutely, yeah. No, there's the quite typical symptoms that you're getting there as well, with the pain and progressing as the day went on, and yeah, it really can be quite relentless and affects your life completely. And Nicola, did you want to talk a bit more about that, the pain that you're experiencing?
Yeah, very similar to Kerry, that dragging sensation and that getting worse and worse throughout the day. And definitely I found the worst time was around ovulation. I just knew it. You just knew that, and it was also depended on what side I was ovulating, because my right side was okay, it was my left side, so I could tell if it was the left hand side that was ovulating, really. And it was almost like doctors didn't really believe that you could know exactly that was definitely wet, but I just knew, because it was just so, I just kept a diary of it, and I just knew that's what it was. When it got worse, and it also causes quite a lot of, well, especially in my case, bowel problems as well, because it just, which have also all totally disappeared. Yeah, and it's the fatigue. It just wears you down, and some days, yeah, you just didn't want to get up and walk. It was just so painful. But you look so well from the outside. This is the thing.
The hard thing, yeah.
Absolutely, yeah. I mean, Narayan, did you want to come in here? I mean, and to talk about this is really typifies the journeys that women go through with this condition.
Yeah.
That
and I was just going to pick up on one thing that Nicola said, that she hadn't realized how much, what you, in your own words, I think Nicola said, you hadn't realized how much pain you were in till you were, had the procedure on the other side, of it, and that again is something that, we both hear time and time again. So I mean, that's really, really insightful to know that, how much, how especially ladies who've had children, so almost, put up with it because they think that's just what it's like. Can you just speak, maybe expand on that a little bit, Kerry and Nicola?
Yeah, I mean, it affects your mental health, it affects your relationships with people. It just overtook my life towards, with the last sort of 6 months to a year. It just everything was around that. Some weekends, things that were planned I couldn't do because I just didn't feel, I was in so much pain, I just couldn't. It's just your whole quality of life is just not where it should be. And I just think we're just not, I think where it is so, like I say, my GP had never heard of it. I just think there's not enough education out there with health professionals about it, and even some gynecologists as well. So it was only really me pushing my gynecologist that I got referred, because basically I asked to be.
I think that's quite typical, as I said, quite typical histories really, in the fact that you've done your research, you found the condition yourself in some ways, and even the GPs and even the gynecologists who are seeing both of you are unaware of the condition and how it can be treated successfully. So that's really what highlights the purpose of this panel event tonight, to really try and push this to the public, to our own clinicians, and even to our own interventional radiologists. So the other thing I just wanted to mention there, Nicola, is the fact that you had a small focus of endometriosis, and the fact that you can have with this conditions, the conditions that are also there in the background. That's why I like to do MRIs, because it really helps not only to diagnose the veins, but other causes of pelvic pain, because there are lots of other causes of pelvic pain. And also helps in the fact that when we come to do the consultations and the consenting process, this is one of the most straightforward procedures we can do to help. Endometriosis obviously could be another cause for pelvic pain, but we can try and treat one of these conditions first and then see if it works, I suppose. Is that your experience as well, Narayan? There's lots of other causes of pelvic pain that we can pick up on the MRIs.
Yeah, absolutely. And like you, I think that that initial investigation, and in our case, we do MRI scans as well. We find really, really helpful to understand exactly what's going on with the venous anatomy within the pelvis and the abdomen, but also is exactly that, looking for other possible causes, and sort of and being able to have that informed discussion about what we think is a likely cause here, because they're all slightly different in different people, but and I think that's and it really brings it together, that that MRI scan. Now up and down the country there are people who do other forms of imaging, and some people would say certain types of ultrasound scans, especially transvaginal ultrasound scan, can give good information. But there is, again, a degree of variability in how it's done, the expertise in doing it. So like you, Aidan, we do use MRI scan as our, mainstay of investigation, for sure.
Yeah, absolutely. I just want to also just to highlight for anyone watching, any women who think that they've got the condition, that every single woman I treat is quite unique in the pain history. Not everyone has the typical dragging sensation on constant pelvic pain. Some women get really acute episodes where it will knock them for six for a few days, and also unrelenting, and even they'll be on opiates as well. And so that pain can radiate into one leg, into the other leg. It can go into the back. You can get bladder symptoms, bowel symptoms. I've even treated a woman who got pain while she ate. So every single woman I treat has got a different history. So when you read the internet and you read the typical symptoms, it's not necessarily the case, that there are lots and lots of other symptoms, and everyone can have slightly different variations of that. Some women will feel the pain in the left more than the right, or the right more than the left, and then some women will feel it more centrally. I don't know what you found as well, Narayan. That, I mean, it's not everyone fits the mold, is it?
Exactly right. And that, the type of pain, when the pain is worse, we heard that, typically, a lot of women do say it's worse as the day goes along, but that's not always the case. And what Nicola also pointed out, that around the time of ovulation, it gets worse. So there are different things that trigger the pain, and we see, quite different variabilities. Some ladies, find it much more uncomfortable in the summer months. Some women find it more uncomfortable in the winter months. And so it speaks to the fact that you can get, a broad spectrum of, how it affects individual patients. And it's about sort of putting that together with what we see and understand about the vein anatomy to decide what the treatment is. So that's exactly right, that you can get what's typical, but a lot of things that can be due to the venous disorders can be atypical also.
It's also such a non-invasive procedure as well. That's, when you think of some of the huge gynae ops that are out there, which take weeks to recover, and this is just not at all. You recover so quickly from it as well, and you get the benefits so quickly as well.
Leading on to that then, Nicola, do you want to talk through the procedure and the day and what you experienced during and afterwards?
Yeah, so I just obviously went into the where it was, and I think so you go in through the jugular, don't you? And you just, and you're slightly sedated, but not complete, you're still aware of what's going on. And then the one thing I do remember is you said to me that if I feel the pain that I feel really intensely, you've got to sort of think you're on the right track to the right spot. And that's exactly what happened. It was really intense when you got to the right spot. And I just, felt the pain intensely when you got to that part. And then, but it was after that, it was all very simple. The procedure finished, I went back, had to lay down for 4 hours, and then I was sort of up and ready to go, really, back. So it's just, in for the day. It was just, really, really, it was just so easy. I just couldn't believe how painless it was, really.
And then, Kerry, do you want to talk through the day for yourself?
Yes, so the day was actually very smooth. I came in the morning, and I was taken down to radiology, and they gave me an injection into my hand with a local anaesthetic, but I was fully aware of what was going on, and then they put an injection into my neck and gradually went down into my pelvis. But Dr. Shaw actually talked me through the whole thing, and he said I would feel certain pressure within the area, and he said to tell him which areas hurt so that he'd know where to put the certain coils into the veins. But the whole procedure, I felt very relaxed and calm. He had music playing. And it seemed to be over very quickly, and then I had a nurse with me the whole time as well. So, and then when I was taken back down, I just had to sort of lay still for 4 hours, and then gradually get up and get ready to go home. So the whole day was quite smooth running, if I'm honest, and then I was home to sort of relax in my own bed. So
I'm glad you had both that such positive experiences. I find music absolutely essential for the doing procedures too. Yeah.
I mean, I think that's key. I mean, that's really important, because I think, a lot of, when, ladies come to see us and they, and you're describing for the first time, because of course, Nicola, you and Kerry have both experienced it, but really to hear it from both of you is so key, because, as much as Aidan and I can explain it to someone, I'm sure when, Aidan told you what he was going to do when you heard it for the first time in clinic, not knowing what that experience is going to be like, it can be, anxious for, it might cause a degree of anxiety, but it really sort of knowing what, how you experienced it, and looking back now, it'll be really, it's really helpful for anyone who's potentially undergoing this to sort of understand, just to understand what that's going to be like.
I mean, it saved me, quite a painful operation as well, which I was on a waiting list for, and I didn't need, I don't need it.
Yeah.
So in a way, it was.
Can I ask you Can I ask you what your recovery was like? What could you do like that evening, the next day, the day after that?
Yeah, I mean, I was, I was more or less okay. I felt a little, I was probably a bit wary. I think you're always a bit wary, aren't you, afterwards, not to do too much. But yeah, I mean, I must admit, within 2 weeks, I was back to normal totally.
Yeah.
Yeah, and if not more so, because like I say, I've managed to get back to the gym and exercise. I've lost over a stone in weight, I think, since I had it done. So because I have so much more energy.
Yeah. And so what was it? I mean, you probably don't remember now, but, what was it like lying on, on the table, sedated, but, having that done, can you just describe to someone who may be having it done, next week or the week after, what the feeling
I think you're apprehensive, aren't you, obviously, but as Kerry said, everyone really put you at ease, and, it's a really great team that are in there with you. You feel very much at ease, and it was just, there are no overwhelming memories, because it was obviously a very positive experience, and it just went really quickly as well. It's it seemed very quick.
Carrie, have you got anything to say about what?
Yes, I definitely agree with Nicola. I felt relaxed throughout the whole thing, and the nurses and staff at the Pembury actually were amazing, and I had such a good level of care there. So they made me feel like I was in good hands. So that was good.
It's great. Yeah, I mean, I've got to say, you do these procedures, but you can't do them without a great team. And I'm very lucky on both sites to have such great nursing staff who do put the patients at ease. It's great. So I'm so happy that you had such good experiences. So I just wanted to talk to you, Narayan, about sort of a small little bit of technical aspects in regards to the fact that both Nicola and Kerry mentioned there. One thing I do ask when I'm doing the procedure is when I do use the sclerotherapy foam, Narayan, which I know you use as well. I don't know if you found this, but I asked the patient when I use it, is that simulating the pain that you usually feel? And I find that if the patient says yes, that's the pain I feel, I find it's a really positive indicator that the procedure will likely work. I haven't seen that written anywhere, but I don't know if you've had that experience as well, but I just find it a really positive correlation with the success.
Yeah, absolutely. And I completely agree. I think, again, because of the nature of, we know that, the veins inside the abdomen and pelvis can be all interlinked and connected in different ways in different people. Really, if you can, simulate or reproduce that pain when you inject the sclerosant, I agree with you 100%. That's a really good sign that you've hit the spot, really. And we see that commonly as well, and really sort of spending, being patient, taking your time, and being relaxed and sort of getting into all the possible areas is very rewarding, because that you're then able to really get to the bottom of what's causing the issues. So yeah, and that for me would be the top tip that I completely agree with you, which I'd say just be patient, take your time, just make sure you get into all the possible places that you need to get into to do your complete assessment and evaluation. So no, I on that point I completely agree.
So then, Kerry, if you want to just summarize how things changed after the procedure.
So it took me a few weeks probably to recover. I'd say I had sort of a little bit like flu type symptoms. So I was quite sleepy after. I needed a lot of rest. Then gradually I started to start exercising and started feeling quite like a lot better in myself. And then the pressure has completely gone now, which is, I mean, it's absolutely amazing, because that was just awful, having to deal with that day in, day out. And also my leg pain. So, I mean, I am still dealing with some other stuff alongside. I'm due to have a laparoscopy, possibly for having endometriosis, which wasn't checked back in 2019. But overall, since Dr. Shaw has helped me, I mean, I've felt so much better in myself, and my mood feels a lot better as well because of that. So thank you so much.
It's great. It's great that you've had such a positive experience and that's worked for you. There's something to say, Narayan. I don't know. There's one thing that we always speak to patients. It doesn't work for everyone, unfortunately. It's one thing we have to mention, that it's even in sometimes the most perfect patient with dilated veins, you do the same treatment and it doesn't work. So it's one thing I always mention on consenting. I don't know about you, Narayan, that you'd love for it to work with everyone like this, but it doesn't always.
Yeah, and that's right, and that speaks to the why you can this isn't an exact science. It's not 100% black or white situation, but we understand it better, and the fact that but in as in your case, in the vast majority of ladies we treat, do see an improvement. But I completely agree with you. It's not it's not in every single person, but when it does work, it can be, as Nicola and Kerry described, quite life-changing, and it's and its impact cannot be underestimated. And the fact that as in Nicola and Kerry's own words, a relatively simple procedure, or a minimally invasive procedure, which is a day case procedure done through pretty much a pinhole in the neck, as they described, can have such a big impact on one's life, cannot be underestimated. So you're right. I mean, that I think we're all learning as we're going along. I think we've learned much more over the course of the last few years than we have done for many years before that. And I'm sure we'll refine it even more. But I think in a large number of patients, we can make a huge difference to their life, and that's I think that's the key message to get across.
Yeah, absolutely. So I think we can wrap up there, Narayan, unless you've got something else you want to talk about. Yeah, and I just want to say a massive thank you to Nicola and Kerry for joining us this evening and giving us an insight into what they've been through and the procedure itself. And I think hopefully to anyone watching this, whether or not you're a patient, a clinician, an intervention radiologist, if you're a patient and clinician, just think about it as a condition. Think about it on the imaging. If you see that on the imaging, just try and marry it up with the patient's symptoms. And for me, I feel very lucky where I am. I have clinicians now who think about it, having treated it now for quite a length of time. And for any intervention radiologist who isn't doing this procedure, there's not many procedures that we do that can genuinely make such a difference to a patient's life. A lot of the time we're dealing with patients, unfortunately, with malignancy and palliating symptoms, but this, as can be seen, is a real game changer in patients. And I encourage any intervention radiologist to try and learn the procedure and try and go even to a centre that does it. Don't know about you, Narayan, but or myself, if you wanted to come and see the procedure and learn it for yourself, because I think there's thousands, if not millions, of women around the world who are underdiagnosed and undertreated with this condition. And so I'm sure we've hopefully made a difference in raising the awareness. So thank you to everyone for joining this evening. And thank you again.